I'd like to formally welcome you to the Interview and Beyond, our workshop for students applying for the 2019 cycle. This is for various health professions. I know we have quite a few medical and dental students in the audience, so we'll keep it and allopathic and osteopathic medical school. So we'll keep you guys all in mind as we progress through this. All right, so a little bit about our agenda today. We're going to talk about why schools hold interviews. It's really important to know what the agenda of the school is as you're going in as an interviewer or interviewee. How to prepare for your interviews. We'll talk about the interview day itself and how you can ensure that you are presenting your best self on that day. The different styles of interviews that schools may hold beyond just the typical one-on-one interview, those being multiple mini interviews and also group interviews. And then how to follow up on interviews after the day has concluded to show that you're interested and ensure that you are putting your best foot forward. So why do schools hold interviews? Well, it's important to note that they're looking to recruit great students, and that means they want you. I know right now it's probably a little bit stressful now that you've submitted applications and likely quite a bit of your secondary applications. And now it's a waiting game. It's important to remember that medical schools want to fill their seats. They're excited about their entering medical school class just as much as you're excited about going to medical school. So it's just important to view it in that perspective. They also want to learn things about you that they can't read in your application. Learn about your passions, your interests, what has brought you to apply to medical school and to pursue a career in medicine. They're also looking to assess your core competencies. So these can be found on the AAMC website at the link provided here. They'll include interpersonal as well as intrapersonal competencies. So things like your resilience, your teamwork, social skills. They also include your thinking and reasoning competencies, critical thinking ability, and scientific inquiry, as well as science competencies, because they'll be ensuring that you are prepared for the rigors of medical school training. Finally, medical schools hold interviews because they want to determine if their school is a good match for who you are as a candidate. So what that means is ensuring that your overall mission and philosophy for wanting to enter this profession is aligned with their mission and philosophy as an institution. So many of you will begin to receive interview invitations soon. We've already seen a few trickle in, and they'll start to pick up pace as we progress through the remainder of the summer and into the fall. When you do receive an interview invitation, it's really important to respond quickly and politely to that invitation. So you don't want to be coy and wait a day and not seem overly eager. Medical schools should know that this is the most important thing to you, and they want to see your enthusiasm. So responding quickly as soon as you see that email or that invitation is certainly appropriate. Once you do that, you'll go online to schedule your interview. You want to choose from the days that they offer, if possible. So making every effort to try and do that. However, there are occasions on which you will not be able to accommodate a date that is offered to you. So if that's absolutely not possible, you can certainly contact the school to let them know this and possibly discuss alternative dates to come in for your interview. If you're traveling for an interview, for example, by plane to a new city, and you've applied to other schools in that area, it can be appropriate to contact other schools there to let them know that you're going to be available and local during a particular time frame. That way, you don't have to necessarily worry about taking 2 trips, perhaps even across the country if that's the location of your interview, to try to group them together. That being said, try not to book 2 interviews 2 days in a row. It can be very stressful to do this, especially if they're not in the same locale. So if, for example, you have an interview that you'll be traveling to by plane or train, or a long distance by car, and then the following one is close to home, perhaps that's Boston, doing that 2 days in a row can be overwhelming, and it might prevent you from putting your best foot forward on interview day. So the next step in preparing for your interview after you've replied to that invitation and set your date and confirm that you have the time off work to attend that interview, you want to ensure that everyone who will be affected by the interview knows about it, that you're preparing for it. And part of that preparation is knowing your application. So things you should do with regard to your application before you go to your interview is to review it and be ready to answer any questions about your application. So experiences that you included on your application, your personal statement that's included on your application, your grades are all there as well, your coursework. From these, you want to be able to articulate your strengths, have stories and examples ready. So stories about working at a particular institution or stories about a particular experience. You'll also want to really review your downloaded application and make sure that everything is as you expected. So for example, the medical school application has an SES, a socioeconomic status disadvantaged indicator. This icon appears on your application dependent upon the area in which you grew up, whether it's rural, whether the area is overall considered an underrepresented and underserved community. So this might be something that once your application was verified or once your application was submitted, that appeared on your application. And so you'll just want to ensure that you know that that's there, and just know that that's something that you want to be cognizant of. I do want to jump back for a second and answer a question that we received from a student. So what about scheduling 2 interviews back to back in the same city? So I think this is something that is a little bit more acceptable than scheduling 2 interviews back to back in 2 different cities, because you want to be able to account for travel time. So for example, if you're interviewing in Washington, D.C. on a Tuesday, flying back Tuesday night, and then interviewing in Boston on a Wednesday, that might be really difficult to manage. However, it is more manageable if you're staying in the same locale that particular night. So I think it's more acceptable to do this. However, it might be nice to give yourself a little bit of a reprieve and a day to recuperate and think about your next interview before then going into your second interview. So if you have the option to not do back to back, but to schedule close together, that would be, I think, the way to go first and foremost. But if you're going to be in the same city, it's more acceptable to do an interview on back-to-back days than it would be if they were in separate cities. So moving right along, the final thing in reviewing your application is not assuming that the interviewer will have access to your application. A lot of interviews are blind, meaning that the interviewer does not have access to your application or your personal statement or your academic record. It allows them to get an unbiased view of who you are and not get too caught up on things that are in your record, so that they can really focus on getting to know who you are in the moment. But that being said, you really do want to ensure that you are ready to answer anything that's on your application, and kind of have those stories and examples ready to be able to talk about those. So In preparation, you also need to know yourself and really do some exploration on your motivation to attend medical school, what preparation you've taken on your path to medical school, and knowing trends in the particular field to which you aspire. So that motivation piece, you want to be able to answer the following questions: why you're interested in medicine, what contributions you may want to make to the field, and how hard you're willing to work. Self-motivation, goal-orientedness are things that are very important and things that you'll want to emphasize. Clinical preparation will be how your clinical experience has shaped your understanding of the practice of medicine. This clinical experience can include examples of your cultural awareness, demonstrating knowledge of how sociocultural factors may influence health and well-being, knowledge of interprofessional care, so how a clinician works collaboratively as a member of a patient care team, knowledge of social determinants of health. So again, that can be related to cultural awareness, but also an awareness of the demographic setting in which you've worked, and awareness of ethical challenges in medicine, ethical challenges that you may have directly or indirectly observed or experienced. Next, understanding trends in the field. This shows that you've researched the field and are really invested in pursuing this track. These can include current issues in medicine. A couple of examples can be lack of primary care providers, ethical issues with electronic records, animal euthanasia, or malpractice issues. You'll want to be able to identify problems that you would like to address as a future physician. But that being said, you also want to ensure that you're talking in a way that shows you are cognizant of these issues and ways in which you hope to do these things, but remembering that you are talking to professionals who are already in the field. So not offering an example that would necessarily state that you would be able to solve any particular problem independently, but just remembering that these are things, overall goals that you'd like to address as a physician or a doctor. And then also changes that might affect your practice and how you feel about them. So changes in documentation, technological research, those types of changes, and how this affects clinical practice and how you would address those. Next in your preparation is reviewing the school that you'll be interviewing with. So for this, it's extremely important to do in-depth research of each school before the interview. This is something that you likely have already done a little bit or even a great deal when you were selecting your schools list and writing your secondaries. But that being said, you want to go back to your notes if you have them, and you'll want to go back to each school's website to assess their mission, their strengths, and take notes on these to ensure that you know all that you can about a school before going in for your interview. In doing this, you'll want to be able to have 4 to 5 reasons listed for why you want to go to that particular school. So this goes beyond why you want to go to medical school or to dental school, and dives deeper into why you want to go to a particular institution. What is it about that institution that is so appealing to you? Next, if you haven't done this already, you'll want to try to get connected with a Northeastern alumni mentor. We have a great mentor network, and in order to be set up or matched with a mentor, you can contact the pre-health office, either myself or Cynthia, to see if there's a mentor at your school. We don't have a mentor at every single school. The mentor list is something that is self-selected, so students volunteer to be a mentor. But we do have quite a bit out there, so definitely tap into that resource if you can. We do also have interview feedback from Northeastern alumni who have interviewed at these schools. And this is quite an exhaustive list of interview feedback. The link is provided below. In an email that you received from Cynthia perhaps a week or two ago now, there was also a link where you can provide feedback for future Huskies. So definitely pay it forward if and when you get your interview invitations. So getting to know the school means reviewing their curriculum and the different components that really make up that curriculum. So the first is whether the curriculum is lecture-based, discussion-based, or case learning. And knowing what each of those really entails. So lecture is that traditional medical school curriculum. You have that more discussion-based curriculum that's going to be more interactive with the lecturers and students, and case-based learning, where students will be provided with a case that they'll work together collaboratively to try to find a solution. So knowing which of these your particular school has employed for their curriculum. You'll also want to know what the entering class size is and the demographics of that class to know what your particular cohort of medical school peers will be like, whether your school has student support services, your pass and match rates for residency, and any assistance that is offered for students who perhaps don't pass or match with a residency. Research opportunities and requirements for students, clinical opportunities within the first 2 years, the types of patient populations that are served locally by affiliated hospitals with your medical school, residency programs that are hosted by the medical school, and what their affiliated hospitals are. Some medical schools have numerous affiliated hospitals, others only have one. It really depends on where you'll be interviewing. Any dual degree opportunities that the school may have for either students who are entering as a dual degree candidate or considering a dual degree after they arrive at medical school. That's something that for the MBA and MPH can often be added after medical school has commenced. Any international opportunities while you're in medical school. These can be service opportunities or abroad or away rotations. And I think the most practical review is really seeing what the debt load is going to be of graduates and just being able to anticipate what that might be. So a question we received from a student about knowing things such as class size, support, match rates, etc. With regard to the school is really just to ensure and why this is important going into an interview. And I think it's really important to know going in, because if a school is asking you why you want to attend a particular institution, and part of that is you want to work with a particular patient population, or you want to work with a particular within a particular type of curriculum, the pass and match rates will be reflective of the types of residencies you might be considering. If you're already thinking of particular specialties, though you'll do much of that exploration while you're in medical school. I think when it comes to reviewing curriculum, comes to reviewing the school, more knowledge is better. And if you're ever asked a question on something with regard to a school's demographics or school services that they're offered, or why support services might be important to you, if that's something that you are looking for in a school, it's important to know those things. So I guess the short answer of it is some of these will be more important to some students than to others. So make sure that you are aware of the things about a school that are important to you and that make you a good fit for the school and that appeal to you about the school. And that's a really nice segue into highlighting your fit. So again, some of those things that we had just discussed are going to be more appealing to some students than to others. Some of those services, some of the curricular nuances. When you're considering all of those things, you'll also want to ensure that you are doing your research so that you are able to highlight your particular fit for a school. So, for example, you want to review your clinical experience and compare that with the school's clinical opportunities and clinical populations that they're serving clinically. You'll also want to consider your research interests and whether a school's ongoing projects, partnerships, and grants are aligned with your research interests or your past research experiences. Consider your service experiences, the ways in which you have engaged with your community, and also the way that schools' programs engage with their communities, partnerships they have, and service opportunities available to current medical school students. Consider other ongoing activities and projects, how that might align with the school's niche, their mission, their focus. So drawing upon those connections and seeing how you as an individual, as a candidate, can really connect to a school's program and can really connect to a school's overall mission and focus. And ensuring that you know what those things are so that you can speak to them in your interview. So once you've done all your review on a school, once you've reviewed your application and really done a thorough self-assessment on who you are as a candidate, next you'll want to ensure that you are practicing for your interview. It's important that you prepare answers for classic questions that you might be asked. Those may be, why do you want to be a doctor? Why do you want to be a dentist? Those questions can include, why do you want to attend our school? Or what is it about our school that appeals to you? What's your philosophy of practice? Or other classic questions that you've probably heard people ask you already in your daily interactions. So just ensure that you have prepared those. Next, you'll want to ensure that you practice answering your questions aloud. In our heads, we might be able to formulate the perfect answers to questions, but until you hear yourself say those answers aloud, it's really hard to gauge what your level of enthusiasm may be, how you want to present your answers, how quickly or how slowly you might be answering those questions and ensuring that you're putting your best self forward. Fortunately, we do have a system that will allow you to videotape yourself in essentially a mock interview. The link is provided here. It's called Interview Stream. Interview Stream is neat in that you can write in questions that the system will then spit back to you as an avatar, so that it will flow like a true interview, and then you'll be able to view it after the fact. If you wanted to do a more blind interview stream, you could ask someone else to input the questions so that you don't know what questions you're going to be asked, so it seems more real time and more of a natural interview flow. But that's your decision to make. I do recommend this if you're interested in getting some interview practice. Also, you can get feedback from some resources that are here on campus. So, for example, you can set up a mock interview with the pre-health advisor. You can do this via your My Northeastern or by email if you no longer have access to your My Northeastern due to graduation. Mock interviews are about an hour long, and they can be held with either a pre-health advisor, myself, or Cynthia. It does not need to be the person who necessarily conducted your committee letter interview. I recommend that students, if they do choose this option, to do this within about 10 days of your scheduled interview so that your feedback is fresh in your mind and you've had that practice close to when you're going into your actual interview. And also you'll want to set up your mock interview after you've received an interview invitation. You can also schedule an appointment for a mock interview with career development. This can also be done via your My Northeastern, or you can schedule it by telephone. In practicing interview questions and preparing answers and answering those aloud, you'll want to try to get feedback from multiple people. These can be many different people in your life, roommates, friends, mentors, a supervisor, perhaps someone who's in a supervisory role, someone who you might be a little bit or scared of and you want to impress, someone who might build up your nerves a little bit, because it is normal to feel nervous on interview day, and that's okay. But you just want to get comfortable feeling that way and be able to answer questions in different types of settings and with different types of people. So try to get as much feedback as possible. There's no such thing as too much practice. We'll be talking about MMI and group interviews in just a bit. Guys, if you just want to hold on a little bit, we are getting there. So for the interview stream, or if you're just going to videotape your interview on your own, there are a few things you're going to want to do in reviewing that taped interview. First is to assess body language. So that's your posture. With regard to posture, you'll want to, it's a little harder with the videotape, but leaning in, not slouching, gestures. So ensuring you're not making distracting gestures or big movements, shaking your hands or kind of twisting your hands or shaking your foot, things like that. Eye contact, so not looking up at the ceiling or down at your feet. And other nervous habits that you might have, knuckle cracking, saying things like a lot. Assessing all of those things and then going back and seeing how you can remedy those in additional practice. Reviewing your tone. Like I mentioned before, it is okay to be nervous in interviews. This is one of the most important days, and you're really excited and enthusiastic about going to medical school. So it's okay that it's the most important thing in the world to you. But sometimes nerves can affect our whole emotional output. So what you want to ensure is that nerves does not then translate to boredom or lack of interest. You want to be enthusiastic and be as confident in your abilities as possible. Remember that you were asked to come in for an interview. Medical schools are interested in you. You should be confident, and it's okay to be confident, and it's actually encouraged to be that way. In reviewing your tape, also assess the ways in which you presented yourself well and repeat those. So identify your strengths in the interview from your tape and try to repeat those in subsequent practices and again on interview day. So we've made it to the big day, your interview day. And nerves will be there. That's okay. You'll be fine. You'll want to just make sure that before you go into your interview, review your notes about the school. Make sure you know the things that you need to know about the school, your fit, why you want to go there. Arrive early. We suggest 30 minutes early just to ensure that you get to where you need to be. But when it comes to going in for the actual interview, so into the office suite, for example, that you were asked to arrive at, try not to go in until about 10 minutes before. Arriving too early can just be a little off-putting for you because then you're waiting there. So try not to go in until about 10 minutes before you go in. Practice deep breathing. If it calms you to drink herbal tea, you can do that. Write 10 positive things about you before you go to the interview and read those before you go in to motivate yourself and to uplift yourself before you go in there. And stand like a superhero. Be confident. And we'll be sending a link to that TED Talk later also with this presentation. So you'll know what I mean more later about that. While you want to be courteous to everyone who you encounter, you don't necessarily need to talk to anybody who might make you nervous. So you can stay reserved in your waiting period before you go into your interview if that's going to make you nervous to talk to anybody, but make sure you're still courteous to all of those people who are around you. I can't overstate this enough. Dress professionally and conservatively. Medical schools are very conservative, so you want to ensure that you are representing yourself that way as well. So wearing a suit, trying not to wear ostentatious jewelry or makeup, light fragrances, as many people can be sensitive to perfumes or colognes. So just ensuring that you're being cognizant of the conservativeness of medical schools, but also, how you may be perceived. Because many schools or all schools will have a walking tour. I guess they all depend on the size of the school, how much walking you'll do. But be prepared to walk. So wear comfortable shoes, or bring comfortable shoes with you that you can change into for the walking tour. Just something to be prepared about. Also, as soon as you go in, that 10 minutes before, when you arrive, turn off your cell phone, put that away, and don't chew any gum. That can certainly be distracting in an interview. And if you have gum in your mouth and you get in there and you don't know how to discard of it, that might be off-putting as well. So no gum, no cell phones. As I mentioned before, be courteous to everyone. That includes your fellow candidates who might be there also, medical school students or other students you might see, the administrative staff in the office, of course, your interviewers, and anyone else on campus. You want to show your best self from the moment you step on that campus until the moment you leave the campus with any person that you encounter. So make sure you remain courteous to everyone. Pay attention to body language. When you meet someone, you want to give a firm but not a crushing handshake. You want to be confident and sit up tall. When you talk to somebody, lean slightly forward to show that you're interested in what they're saying. Make eye contact with people. Try not to avert gaze if you're having a conversation with someone. And again, don't worry about a little nervousness. It's totally okay for an interviewer to see that this is the most important thing in the world to you. It should be the most important thing in the world to you. And when we've talked to admissions committees about this before, they have stated that they'd rather see a little nervousness than risk someone coming off as bored or uninterested because there's no affect to them. Letting nerves paralyze you would not work to your advantage. Showing nervousness is a little okay. So just keep that in mind. And then finally, be yourself. Medical schools want you. They want good students. You've all showcased this. So show your enthusiasm. Act confident in your experiences and your abilities. Smile and get excited. This is a really big day for you. So you'll want to and show that you're really excited about what's going on here. A little bit of information on what to expect on interview days. So they're typically a full day. They usually include at least one meal, usually lunch and maybe breakfast, depending on the type of interview and the length of day. You will have a tour of the school and a presentation from admissions and financial aid as part of the interview day. The interview itself, when you're being asked questions, will last about 30 minutes to 2 hours of your day, depending on the style of interview, which we'll review in a little bit. Your interview may be in the same building as admissions, or you may need to travel to get to it. So that's something that you should just be prepared for, that not all of your activities of the day may be in the same building. Professionalism. This is extremely essential and important to your interviews. Professionalism is about who you will be as a future professional. Medical schools are interviewing you to become a doctor. And it's important to note that they are looking at who you will be in the future. They're not, I mean, they are interviewing you for medical school, but they're looking beyond that too. So convey professionalism in all that you do. So things that reflect professionalism are your appearance and your interactions. Those are things that we kind of touched upon already. Also your digital media presence. So ensuring that you are conveying yourself in a professional manner online in the way that you would in person. So, for example, you don't want to tear apart somebody on a Yelp review and be really aggressive or rude or anything like that. You want your presence always to convey professionalism. That's not to say that professionalism cannot be conveyed in many ways. Just be cognizant of your digital media presence, also your interactions and appearance. What I mean by professionalism is characteristics such as integrity, ethical reasoning, maturity of self, knowledge of self, compassion and altruism are extremely important as you enter into a caregiving profession. Showing that you are open to continuous improvement, that you respond well to feedback, and being non-judgmental. You want to have an open-mindedness, professionalism in communication, non-judgmental communication. These types of characteristics are things that will be assessed in your interview. In the interview, following things you'll want to convey or show. So certainly openness and honesty. Answer questions honestly. You'll want to focus on your contributions and what you learned when asked about experiences, not necessarily the tasks performed. So we're not going to want to talk about a job description, but rather focus on your contributions to a particular role. It's okay to pause briefly to think of an answer before answering it. Oftentimes when you're the interviewee, a pause can seem like a lifetime. But in reality, it's very brief, and it's okay to think about things before you answer them. So keep that in mind. Show your passion and enthusiasm. So you want to be animated. And what I mean by that is show your emotion here. if you're an introverted person, that's totally fine. You don't need to be anybody but yourself. But all of you certainly are passionate about entering this profession and you want to convey that. Ask questions at the conclusion of the interview. If you're given the opportunity to ask questions about the school that aren't answered on the website. Ask open-ended questions that can result in dialogue with the person who's interviewing you. What you want to avoid is questions that might make your interviewer feel defensive, uncomfortable, or ignorant. So, for example, for a newer medical college who maybe haven't had a class go through a residency match yet, there are ways to ask a question that might put the interviewer on the defensive, like, so you're a new medical college. How are you going to handle residency? As opposed to something that facilitates more of an open dialogue, such as a new medical college, what plans has your institution implemented with regard to the upcoming residency match of your first class? Something like that. If asked, admit a deficiency, but you want to be able to turn it into a positive. So, for example, if asked about, what are your weaknesses? A response you may have is, well, I tend to be a big picture thinker. I'd have a hard time focusing on the little things. So I try to frequently reflect on that to ensure that I'm addressing everything that needs to be done in a timely fashion. Of course, that's just a really vague example, but you kind of get the gist of what I'm trying to say here. Show how well you work on a team and collaborate with others. These professions are interprofessional. You'll work with colleagues, and interviewers are assessing future colleagues. You might be working alongside these people someday. So they want to assess whether they feel that you would be a good teammate. So show that in your interview as well. All right. So apart from this traditional one-on-one interview format, there are other types of interviews that medical schools might employ. It's a different format. They all have the same goal. They're all trying to assess who you are as a candidate and assess your fit for their program. For multiple mini interviews, you have the opportunity to meet more interviewers, and it's also more objective. So the way they run is candidates will all respond to the same set of questions that will be asked by the same set of interviewers, meaning that one interviewer will ask the same question of all the candidates they see that day. It's more objective because the way in which that particular interviewer assesses you is the same way that they'll be assessing every other candidate that they interact with. The format of multiple mini interviews does vary. Typically, there are a set of rooms in which the interviewer is stationed inside the room. The candidates are stationed outside the room. You'll have typically 2 minutes to read a question that you will answer in the interview. That question is stationed outside the room, usually on a door or in a chair. Then you'll be invited to go inside the room to respond to the question. That will typically be about 6 to 8 minutes. Then, once your time has concluded, you'll rotate to the next station. Occasionally, there is a minute in between each station to allow you to reset and clear your mind. That's not always the case. Sometimes it goes sometimes it goes straight into that 2-minute read. This scenario typically will last for about 6 to 10 stations, depending on the school. You will know before going in to an interview if this style of interview is being used. The questions in the multiple mini interviews are aimed to determine your intangible qualities, so your ethical judgment, maturity, problem-solving ability, collaborative nature, flexibility. What they don't want you to do or won't expect you to do is answer questions as if you're already a medical professional. So, for example, if a question is about delivering news to a patient about a illness, a diagnosis of an illness, for example, you would not want to enter the room and talk to the patient about all the different facets of this particular disease and create a medical care plan and practice the medicine the way a physician would. What they're looking for you to do in that scenario is how effectively and compassionately you can communicate with the patient while also listening to them and showing good judgment in your interactions. So, ways in which you can try to prepare for the MMI. You can find practice questions online and work on timing your answers. I know 6 to 8 minutes seems like a long time, but it actually does go fairly quickly. So you can find practice questions online. There will be interview information that is provided by the school that you can review. Also, if you go on YouTube, you can find some links to different kind of mock MMI scenarios to see what it might look like to go through an MMI. In preparation, you want to read up on current healthcare issues, practice explaining both sides of an issue, and clearly be able to substantiate your view. So typically there isn't a right or a wrong answer, but once you do answer on a particular healthcare issue, you want to ensure that you follow through and don't waver between one side of the spectrum and then the other. So be able to substantiate your view, but also be able to showcase that you understand both sides of an issue. So another thing you want to be prepared for is some stations may have an actor playing a patient or a coworker in the room with the interviewer. So for example, that case I mentioned earlier where you would have to deliver news to a patient, if you walk in the room, there might be an interviewer and an actor playing the patient that you'll be speaking directly to. Draw upon your experiential preparation as you kind of think about ways that you would answer this question. So your shadowing experiences or your co-ops where you've worked directly with people or seen others work directly with patients, and think about how you would answer questions in a similar scenario. When you read the question, so when you're at the MMI, when you read the question, you want to stop and ask yourself, what is this interviewer trying to assess? What skills or competencies are they looking to assess in my response? Are they looking for my oral communication skills, my teamwork, my critical thinking ability, my ethical responsibility? So keep this in mind when generating your response. You have 2 minutes to review and 6 minutes to respond. So just keep these things in mind. Try to remain calm. And remember, if one of your interviews, one of these mock scenarios doesn't go exactly as you would like or planned, you can go right into that next one, move on from it quickly, and it's a brand new person and a brand new question. So that's kind of the nice thing about MMIs is it's okay if you have one bad station, just try to wipe that off and move on to the next. Group interviews. This is less frequent, but again, it's a different format with the same goal. Here, the format is you'll be in an interview room with multiple interviewers, possibly, and certainly multiple interviewees, so with other candidates. You may be asked traditional questions and you'll be answering one by one. So each candidate will be asked to answer their question individually, or you'll be given a group problem-solving exercise. Here, schools are assessing how well you collaborate with others and how well you effectively problem solve with your peers. Or, in other words, how well you play in the sandbox. This is also assessing if you're going to be a good fit with their interactive problem-based learning. So here is where it becomes really important to know the curriculum for the school that you're applying to. If it's a case-based curriculum, they'll have problem-based learning, interprofessional learning, and this is a type of interview that they may employ. But again, you'll know this before going into your interviews. So this is something that happens really rarely, something you likely will not encounter. But on occasions, it has occurred where a student has been asked an inappropriate question. Those might be your plans to have a family, things about your religion, your finances, your sexual orientation, or some questions about a disability or some other status. You have a few options on how to handle this. If you feel comfortable, you could answer the question. I would caution to do this vaguely and with brevity. You could also ask for clarification to ensure that you know the question being asked and are given information that will be relevant to their decision on whether they want to invite you to be part of their medical school class. And if the question warrants it and you feel this is an inappropriate question that you should not be answering, it's okay and certainly appropriate to state that your private views are not relevant in patient-centered practice, and that for that reason, you would not be answering the question. If this does happen, please contact the pre-health office right away, because we can contact the school to report the inappropriate question. And I think that that is certainly very important for us to do. It upholds ethical practice, and it ensures that your interview is not clouded by an interviewer's inappropriate question. So things to do after your interview. After you leave your interview, you want to make sure you write some notes to yourself about the school. That way, when you are choosing between schools, you can look back on that and kind of review what you thought of each school. You want to send a personalized thank you note to each individual who interviewed and spent time with you. So while you're there, try to obtain business cards for MMIs. Send a general thank you to admissions. You don't need to send one to each of the 6 to 10 interviewers there. In your thank you note, restate your specific reasons for your interest in the school. And if the school is your first choice, say so, but be honest. You don't want to tell every school that you would go there if you're accepted, that it's your number one school. This isn't honest, of course. So you would want to just tell one school, and just don't burn any bridges with regard to that. Many schools will have a second look day if you are accepted to multiple schools, so this does give you another opportunity to learn about the school's culture and consider your fit. And also after the interview, share feedback with your peers. So as I mentioned before, we do have a form from students who attended interviews with their feedback. So try to pay it forward and share your feedback with peers after you have your interviews. So after the interviews, some applicants will be waitlisted. It does happen. Students do get in off the wait list. If this does happen, You want to affirm to the school that you're still interested. If they don't receive something from you that indicates your interest, then they might think that you've been accepted elsewhere or are no longer interested in their school. You can send updates to schools if they accept them, but try not to be a pest. Try not to do this too often. So, for example, you want to update schools with things of substance. So, for example, if your research was published and you wanted to provide that update, that would certainly be a substantial update to provide a school, or end of semester grades or something like that. You also, if you are waitlisted, can send a letter of intent to one school stating that you will go there if accepted. And this again reaffirms your interest in the school. Keep in mind that most MD waitlist activities occurs in May and June, though people do get off the waitlist up to the week before classes start. For DO and dental waitlist activities, it kind of goes all the way to the start of classes also, but it can vary with regard to the start. So it can happen sooner, and it does fluctuate in a way that is not as predictable as the MD waitlist. And so before I review some tips from students who've gone before you, I have a couple of questions that I want to address from students. One, is the MMI similar to Casper? Yes, in that it is assessing those same intangible qualities. It is assessing how you respond to scenarios and your competencies in those regard. That being said, Casper is a bit different just because of the automated format of it, and it's something that is used by very few schools. It's not something that I would say MMI is more of a true interview, whereas Casper is really more of a computer generated assessment of your intangible qualities. So yes, similar. Certainly, I do think though that the MMI is a better indicator of who you are as a candidate, and medical schools will value the interview more strongly in that capacity. Thank you notes. Should they be sent the same day as the interview, or sending it the next day acceptable? I think this is really going to be dependent on when you come home from your interview. Sending the next day is certainly acceptable. If you are able to send it the same day, you certainly can. So yes, it is acceptable to send the next day, but you want to be able to send it in a timely fashion. So within a couple of days of your interview for certain. So tips from students who came before you. Be yourself. Everyday you is who they're looking for. So don't try to be anyone or anything else. They're trying to gauge who you are. So be your authentic self. Practice, practice, practice. Make sure you are telling a story clearly and concisely of who you are. And in order to do that, you want to be able to practice your interview skills. Focus on a few accomplishments that you're especially proud to highlight. So rather than talking about 15 different things, hone in on those things that are most important to you on your path to medical school. Co-op. Co-op is unique. It's something that is unique to Northeastern students. It is a wonderful experience that you've been part of. Be ready to talk about them and how they shaped who you are professionally and how they shaped who you are academically. Don't make excuses for any shortcomings. Acknowledge, take responsibility, and address how you learned and grew from these. So same way that you would address any weaknesses, you want to turn it so that you can highlight how you matured and grew from those experiences. Don't try to be too funny. This is a serious occasion. Interviews are serious. They're really trying to gauge who you are. So cracking jokes and making light of a serious situation may not be perceived positively. So try to remain enthusiastic yet professional at all times. This, depends on how you are, but try not to drink too much coffee or caffeine on interview day. You don't want to be jittery in your interview. You want to be your calm, authentic self. If you're flying, this is especially important. I'm going to highlight this. If you're flying, carry your suit or your outfit for interview day on the plane with you. If your baggage is lost and your interview is the next morning, it may not be possible for you to get your baggage before going to your interview, which means you would have to go to your interview with the clothes you were wearing on the plane. So carry your suit with you. Very important. Don't be afraid if no one talks for a moment. Again, you can take a moment before you answer a question. Silence is okay. Begin to be comfortable with that. Don't read too much into the length of an interview. A busy researcher, for example, might make up their mind that they like you in 10 minutes and that's it. A long interview versus a short interview versus a long interview does not necessarily indicate something good or bad. Focus on yourself here, focus on being your authentic self, and focus on why you want to be in this field, and try to mediate some of your nerves, and you guys will all do absolutely great. Remember, it's a waiting game. Exercise good patience over the next couple of months as these start to come in, and just do your best to, like I said, remain patient and practice when you need to. I'm going to open the floor to you guys if you have any lingering questions, but feel free to sign off. That concludes the session today. Feel free to sign off whenever you have to go, but I'm going to remain on the line for a couple of minutes just to see if anybody has any lingering questions. So thank you so much for joining me today and for coming to the interview workshop. I hope you found it helpful. Again, we'll be emailing this information to you soon. Thanks.